I'm Dr. David Hill, and today we're going to talk about treating sinus infections in babies. Now, babies do get sinus infections, and the hard thing is knowing when they have a cold and when they have a sinus infection. Fortunately, we have a few clues to go by. The first is fever. Now, let me stop right here and say that if you have an infant who is less than 3 months of age and he or she has a fever, how do we define that? Ideally, a rectal temperature greater than 100.4 degrees Fahrenheit or greater than 38 degrees Celsius. If that baby has a fever, you have no idea what that is, but it could be something really bad, like a serious infection of the bloodstream, or of the kidneys, or of the fluid around the brain and spinal cord. So if you've got a newborn with a fever, for gosh sake, get that baby seen immediately by a healthcare provider, because it can be really hard to know what that is. However, if you have an older baby, greater than 3 months of age, who has a fever and some cold symptoms, that may be normal. Some rules though: the fever should not go on greater than 3 days. Usually if you get a cold virus, you get about 3 days of fever and then it goes away. Also, the fever should not be greater than 104 degrees. That's quite unusual in a baby and may signify some really serious disease. So never just assume that that's part of the cold. The doctor needs to look at that baby and see what's going on. Now, if it's over 104 but not yet 105, you got a little time. You might, wait until later in the day. If it's over 105 though, we're going to want to know what's happening with that baby right now. Get him care now. Don't wait. How else do we know? Well, let me tell you how we don't know. Green snot, yellow snot. We don't care what color the snot is. It does not matter. Any cold, you're going to get some green or yellow snot around the 4th or 5th day. That's not a sinus infection. But the snot should be getting better by about 10 to 14 days of illness. So if your baby has been sick for a week and a half, 2 weeks, not getting any better, same old runny nose, now we're thinking hard about a sinus infection and about using antibiotics. Cough may last as long as 3 weeks, but a cough going greater than 3 weeks may suggest a sinus infection as well. If your baby is pulling at his or her ears or seems to be unusually uncomfortable, it can be really tough to know whether a baby has an ear infection or not without a really good look in the ears. So certainly take your baby to see a doctor and see what's going on. Now, what do we do for sinus infections in babies? Well, we use antibiotics. Unless there's an allergy, we like to start with a very basic, straightforward antibiotic like amoxicillin. It works fantastic as long as the baby's not been on amoxicillin in the last 30 days. Your doctor may have another choice that he or she wants to use based on specific circumstances, so be sure and have a good conversation about antibiotic choice and how it's to be used. Talking about sinus infections in babies, I'm Dr. David Hill.